You're listening to the Get to Know TRICARE podcast, your resource for information to help you get the most out of your TRICARE benefit. Hello again, and welcome to another episode of our TRICARE 101 series. I'm Anthony Vieira from the TRICARE Publications team, and today our focus is going to be on those confusing cost terms. Let's face it, when it comes to getting quality and affordable care from your doctor, cost is a factor. And as a TRICARE beneficiary, you may hear terms like premiums and cost share all the time. But some terms like catastrophic cap aren't as well known. By understanding terms like these, you can avoid unexpected expenses. Joining me to demystify some of the cost terms for you is Lennya Bonivento. Lennya is a health systems analyst and member of the Benefit Education and Research team at the Defense Health Agency. Lennya, it's great to have you on. Thanks for joining the show.
Thanks, Anthony. I'm happy to be here.
Sure thing. So in a recent episode of our podcast, your colleague Calvin sat down with me to discuss non-participating providers. And in the midst of our conversation, he mentioned that non-participating providers may charge more than what's called the TRICARE allowable charge. So let's discuss the TRICARE allowable charge. What do beneficiaries need to know?
Non-participating providers may bill the patient up to 15%. And just to clarify, that's 15% above the TRICARE allowable charge. The TRICARE allowable charge is the maximum amount TRICARE will pay a doctor or other provider for a procedure, service, or equipment. So for example, if a doctor bills $200 for a service, the TRICARE allowable charge for that service may be $100. A non-participating doctor could bill $115, which is 15% more than the TRICARE allowable charge. The patient is responsible for any charges above the TRICARE allowable charge. So that's why it's really important and best for our beneficiaries to see participating and network providers. Also, the TRICARE allowable charge applies to all TRICARE plans and may vary by location. And in some cases, federal law requires a set rate.
Now, some plans like TRICARE Select and TRICARE Retired Reserve have what's called an annual deductible. What kind of cost is that?
Well, a deductible is the amount you pay for a covered service before TRICARE starts to pay. As you mentioned, TRICARE Select and TRICARE Retired Reserve have a deductible, but so do TRICARE Reserve Select, TRICARE Young Adult Select option, and TRICARE for Life. For those using TRICARE for Life, a TRICARE deductible applies when a service isn't covered by Medicare, but is covered by TRICARE.
Does TRICARE Prime have an annual deductible?
TRICARE Prime options also have a deductible, but only when using the point of service option. Also, the deductible amount that you pay depends on your sponsor status, rank, and beneficiary group. And as a reminder, deductibles reset every year on January 1. And as always, our active duty service members don't have an annual deductible.
And just to clarify regarding the point of service deductible, that's only for active duty family members, right?
That's correct. The point of service deductible applies to active duty family members, retirees, and their family members.
That's good to know. Okay, Lennya, I've got another cost term for you. This one is cost share.
Sure. A cost share is a percentage of the TRICARE allowable charge for a covered service that you pay. So for example, a retiree enrolled in TRICARE Select under Group A would pay 25% for an outpatient primary visit from a non-network doctor. Cost shares apply to all TRICARE plans, and the percentage amount that somebody pays depends on the plan, beneficiary category, and group. Sometimes you may have more than one cost share if you see several doctors as part of an appointment or have multiple tests. As always, our active duty service members don't have any cost shares.
And beneficiaries can compare cost shares of each plan using the Compare Cost tool at tricare.mil/compare costs. And that Compare Cost tool really comes in handy, and it's user-friendly, it's easy to use. So
yes, I refer to that tool all the time.
Good. So when you think of co-payments and cost shares are not to be confused with one another, right? There's a difference between a cost share and a co-payment.
That's correct. So the difference is that a copayment is a fixed dollar amount that you pay for a covered service or prescription, whereas a cost share is a percentage. Copayments also depend on the TRICARE plan, beneficiary category, group, and the service that the beneficiary gets. There are no copayments or cost shares for preventive care visits under Prime and Select plans. And as always, our active duty service members don't have copayments.
Okay, so the next term on the list is catastrophic cap. Can you shed some light on this one?
Sure thing. The catastrophic cap, or as we call it, the CAT cap, is the amount, the most that you pay out of pocket each year for covered service. It applies to all TRICARE plans and depends on your sponsor status and beneficiary group. It's really a great option because you know exactly how much you're going to pay out of pocket for an entire year. So for example, active duty family members under Group A have a $1,000 catastrophic cap, and then active duty family members under Group B have a $1,058 catastrophic cap. So that means that, let's say, if it started in January, let's say in May, the active duty family member has already spent out of pocket $1,000. That means that for the rest of the year, they're not going to pay anything out of pocket for TRICARE covered services.
Okay, sounds good. Now, some TRICARE plans are listed as premium-based plans. What kind of cost is a premium?
Well, premiums apply to premiums-based plans such as TRICARE Retired Reserve, TRICARE Reserve Select, TRICARE Young Adult, and Continued Healthcare Benefit Program. And premiums are just amounts that you pay monthly or yearly for TRICARE coverage.
And keep in mind, you can have car insurance premiums, life insurance premiums. Premiums are not exclusive to healthcare. So, Lennya, this has been a great discussion. I appreciate you coming by to help demystify some of these cost terms. Before you go, can you remind us again where beneficiaries can go to learn more?
Absolutely. We have a cost terms page on our TRICARE website. So beneficiaries can go to tricare.mil. And then we also have many of our TRICARE publications have a glossary section. And as you mentioned before, they can see all of our TRICARE publications on tricare.mil/publications.
All right. That's very helpful information. Thanks again for coming on and can't wait to have you back.
Thanks for having me. I had a great time.
That's it for today's episode on cost terms. For more information, remember to check out the cost terms page, the TRICARE Compare Cost tool, or the TRICARE Cost and Fee sheet. In our next episode, Lennya is coming back to demystify another process for you, filing claims. For the Get to Know TRICARE podcast, I'm Anthony Vieira. Thanks for listening. We'll be back with another edition of the Get to Know TRICARE podcast soon. For the latest TRICARE news, be sure to visit our website at tricare.mil. And don't forget to contact your TRICARE contractor or your local military hospital or clinic if you have questions or need assistance.